Welcome to the Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM, your flagship stations for the Oakland County Megacast. In addition, today we were on Birmingham Area Municipal Access on Comcast Channel 15 and AT&T Channel 99 in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin, as well as also on the radio in the Bloomfield area on 88.1 WBFH, The Biff, and online today, civiccentertv.com as always, and on the Facebook page today of the West Bloomfield School District, and thank their team for joining us on today's edition of the Oakland County Megacast. Now, as some of you may know if you've been joining us since the very beginning, this is the 1-year anniversary of us doing this program live each and every morning. At this time, 1 year ago, Dave Scott opened the show with Kurt Lawson, wall to wall in our very tiny radio studio to try to keep that 6-foot distance as we began this journey, taking you through the COVID-19 pandemic and doing our part to try to help keep the community in greater West Bloomfield and in Oakland County informed as life changed all around us consistently over the last year. We've been with you as the governor issued her stay-at-home order, as the schools closed, as coronavirus cases both rose and fell over and over again, and as vaccines began to roll out. And as we come out of this pandemic, slowly but surely, we will continue to be there with you. Joining me today, as always, in the studio is Ronnie Dahl.
It's been a long 2 weeks, right,
That's
Tyler?
the longest 2 weeks, yes. It's been a nice, long 2 weeks this year.
In 1 year into this, and the show continues, and the reason being the information changes quite often and frequently as well. And of course, in the beginning, it was about staying safe. And there were so many ins and outs with the stay-at-home order. And then as that continues to be lifted, but then businesses shut down once again and then lifted again. And we are still in the middle of that right now. In fact, the governor is going to be talking at 10:30 this morning. We will try to bring that announcement to you live as well. She will be at Ford Field talking about the mass vaccination clinic. So with her will be the Lieutenant Governor, as well as FEMA, Detroit Lions, Meijer, Henry Ford Health Systems, and Protect Michigan Commission. So that is going to be happening at 10:30 as now the focus in this pandemic switches to try to get as many people vaccinated as quickly as possible. Yeah, and it's important now with that vaccination site coming up and other vaccination sites surely may be behind that throughout the state, that the state government and the Federal Emergency Management Agency and other partnerships that they have formed in the state of Michigan get out ahead of that and inform the public about how that's going to operate, how people can sign up, what they should expect when they are on site there, when they may know whether or not they are going to be able to get their shot at that location, and what they need to do to prepare. As we continue to have more complications come up, but this time it's good complications as we work to get out of the pandemic instead of try to navigate our way through it. Because we should note that here we are, a year into it, and we saw a recent decline in the number of cases. However, they are starting to rise once again. And we'll jump into the headlines so that we can get to our first interview a little bit quicker today. Michigan had the country's 5th highest rate of new COVID-19 cases in the last week and is among 14 states where infections rose over the past 2 weeks, a trend that may be tied to the more contagious coronavirus variant that we know is now spreading through the state of Michigan. 1 out of every 602 Michigan residents was diagnosed with COVID-19 over the 7-day period that ended Monday, a rate that trailed those of only 4 East Coast states. Michigan had the country's 10th highest per capita case rate over the 14-day period that ended Monday. This is according to data compiled by Johns Hopkins University. The 7-day case average was 2,372, an increase of more than 1,000 from the 1,335 7-day average as of March 1st. Now, the positivity rate is one of the things that they pay close attention to. The average positivity rate was 6.4%. It was only 3.8% 2 weeks ago. The good news, though, Tyler, out of all of this, the hospitalizations have increased over the past 3 weeks, but we are still well below the peak from over 3 months ago. So that is good. And more than 60% of the people here in the state of Michigan, ages 65 and older, they have gotten at least one of the vaccine shots.
And we talked yesterday with Rich Studley from the Michigan Chamber of Commerce, who did credit part of these reopenings to being that our case rates have been lower and that hospitalizations haven't been as long because there's been other treatments in place. But what's also been a key is those treatments have been able to be more targeted and more effective because there hasn't been that overwhelming number of people in the hospitals. And I think with the positivity rate rising, as we've seen in the past when that has happened, the biggest concern is not overwhelming our health systems. We can deal with coronavirus cases. We've been doing that for a year. But it's when those cases start to amount that things start to go awry in our health systems, and we have to take more precautions to prevent overwhelming them. And with the positivity rate coming close, but still being a little bit ways away from doubling where it was in the last 7-day period, these variants continuing to be a concern at the state level.
So with that news, though, Michigan's nursing homes don't have to require visitors to get tested for COVID-19 prior to allowing them into the facility. That's under new changes state health officials made Wednesday to its visitation policy. The state still is strongly encouraging testing for indoor visitors, but has removed a mandate that nursing homes require such a test to reflect changes in guidance from the Federal Centers for Medicare and Medicaid Services. Federal guidance also notes visitors are not required to be vaccinated to visit loved ones in nursing homes. Now, the new policy change is a change from March 2nd that required facilities in the state to use point-of-care rapid tests on indoor visitors, or when that option isn't available, to require regular testing 72 hours ahead of a visit. Testing, though, is still recommended by the state. And keep in mind, some individual facilities may still require them for in-person visits, so you need to check with your loved one's facility. The new policy also loosens restrictions requiring appointments for visits and capping visitors at 2 people instead. Federal guidance asks facilities to limit the length of each visit and restrict the number of people based on the size of the building. But the state has administered about 270,000 vaccinations for nursing home residents and staff members and provided more than 1.3 million antigen tests since the start of this pandemic.
Yeah, so the big change there being that these tests aren't going to be required by the state in order to make these visits. They still may be required by individual nursing homes. And that being said, it may be a good idea, regardless of the requirements that are in place either at the nursing home or the state level, to still get that test because of what we've seen over the course of this pandemic, that older people that tend to be living in these nursing homes are more at risk for severe COVID-19 cases. There have been major outbreaks in nursing homes throughout this pandemic, and so taking that extra precaution can only help keep your loved ones safe as you are now going back to visiting them in person, so that we don't have to go back to a situation where we can't have people visiting their loved ones. As we know, that's taken a major toll on both the loved ones and those in the nursing homes over this last year.
Ford making a big announcement yesterday for members of its workforce, saying that they are going to be creating a hybrid remote work plan. So it's a question so many people have been asking. If you've been working from home over the past year, will they still be allowed to work remotely at least some days once the pandemic has faded? Well, on Wednesday, Ford Motor Company told about 30,000 of its employees worldwide who have worked from home that they can continue to do so indefinitely with flexible hours approved by their managers. Now, their schedules will become a work office hybrid. They'll commute to work mainly for group meetings and projects best suited for face-to-face interaction. Ford's announcement, of course, sent one of the clearest signals to date that the pandemic has hastened the cultural shift in Americans' work lives by erasing any stigma around remote work and encouraging the adoption of technology that enables it. There was a report this week from the employment website Indeed, and it says that postings for jobs that mention remote work have more than doubled since the pandemic began, and such job postings are still increasing even while vaccinations are accelerating and the pace of new confirmed COVID cases is starting to decline across the country. So hybrid, I think, hybrid is a good way to go, because there are some meetings and some events that you want to be in person for. And you also wonder too about some of these new employees, especially people, recent college graduates getting out of school for the first time. Sometimes they need that mentorship and getting to know people in the office.
Yeah, and as we spoke recently with the CEO of Automation Alley, this remote work can have a place in any office that is extremely productive. It reduces the amount of chit-chat that you have between employees that's unnecessary and can take time away from productive activities. There's been situations where employees that have been remote have actually had an increase in their productivity by working from home. But on top of that, you don't absolutely have to go one way or the other, because there are still productive reasons to have in-person work and to have that communication within your team to build team camaraderie and to increase teamwork on certain projects. And so I think it is something we're going to see be much more common among a lot of companies, that they promote hybrid work where it is necessary and where it can be productive, but still have moments where they're going to need their people to be in the office in order to continue regular operations.
So, of course, you can find those headlines and so much more. Just go to civiccentertv.com, click on the coronavirus tab. We're going to take a quick break here on the Megacast and jump into our first interview. When we come back, we'll be speaking with the Executive Director for the Michigan Association Superintendents and Administrators. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you back with us here on the Megacast, the 1-year anniversary of the show, Tyler.
Yes, 1 year doing this program each and every day. We've had very few days where we haven't had new news for the people of Greater West Bloomfield and the Oakland County area, and are excited to kick off the second year of this, and hopefully more good news to come than a lot of the bad news we've had in the first year.
It's been a long 2 weeks.
It has, the longest 2 weeks of our lives.
So, but not only our lives, the lives of so many people. We think about our educators and our leaders and how they've had to try to navigate this pandemic with remote learning. It's such a tough time for so many of these superintendents. And to talk more, let's bring in Dr. Tina Kerr. She's the Executive Director for the Michigan Association of Superintendents and Administrators. Great to have you with us.
Well, thank you for having me. I appreciate it.
I know, I believe the first time we spoke with you, you were recently appointed. How are things going?
They're going. I did not expect to still be in COVID after our last discussion, but as you said, we're a year into this and we're continuing to move forward.
But we've learned a lot of things as well. It's been a year of learning, right?
We sure have learned. And you know, this has also created opportunities. And I appreciated hearing what you said about Ford, because we ourselves as an association have really had to look at how we deliver our professional development and our services. And I think we're going to make some changes for the better because of COVID.
What are some of those changes do you anticipate?
Very similar to the idea of a hybrid model. Most of our professional development, we've always offered face-to-face and in person. And we were concerned that you lose some of that rich discussion when you're in a remote environment. But having done this for the last year, we found that we can still be very productive. We can increase the networking, the learning can occur, and it's more on-demand learning, which is very beneficial. It's so hard for our district leaders to leave their district to go get professional development and have that time away from their district. And now by looking at hybrid models, we can kind of have the best of both worlds. They can still be in-house in their district, still learning, but then they do have those opportunities in the hybrid to come face-to-face and work with colleagues from around the state so that they get that other perspective as well.
So, and Dr. Kerr, how does your association work? Is it membership-based?
Yes, it is. Yeah, we have, for the most part, 95% of the public school superintendents in the state are members of our association. And then we also cater to what we call central office administrators. That's that first line assistant or a deputy, curriculum director, business manager. And then we also have a membership for executive assistant secretaries. So the superintendent secretaries are able to come together and learn from each other as well. So we provide all the professional development, the support. We kind of have three arms to our association. One is focused on communication. We really had to change how we communicate with our members during COVID and created a COVID resource page and really tried to ensure our members had all the information they needed to meet the new changes, the standards. Continuity of learning plans was a huge lift for our districts to move forward. And then we have our policy and our legislative arm that supports legislation and policy development that support our members in our school districts. And the last piece, as I said, is that professional development, which is a big part of what we do.
Well, we have learned that we cannot educate and go on like we used to. This year has really, taken like the tree and shake the leaves off to say, hey, it's time to realign and redesign who you are and how we teach our kids. So as you were saying, you are also an advocate and with the lawmakers. School funding, how do you think that's going to change coming out of the pandemic?
Well, it has to change. And the one thing I've said about the pandemic is there is a silver lining because education has typically not been real nimble in how it changes instructional delivery, how we structure our school settings. And the pandemic has taught us that we have to. The other big issue that we've uncovered we knew was a problem was the equity gaps that exist in education. The pandemic showed a spotlight on that. So we can't go back to the way we've always educated children, the way we funded schools. That's going to have to continue to be a priority moving forward. We're in partnership with several groups, one of which is Launch Michigan, which is a coalition of business leaders, philanthropy, and educators around the state. And our main focus is how do we change the funding structure to ensure our students are getting all the resources that they need, especially now, because we know we're going to have to, I call it delayed learning, but we're going to have to help our students be successful moving forward because we will see the repercussions of this pandemic for the next several years.
So what do you think that model could look like, or how would you like it to look?
We've really focused on, there was a large financial study called SFRC that was done several years ago. And one of the things that it showed us is that each student costs differently to educate, whether you're special needs, you're an ELL student. You cannot do a carte blanche student formula to say, I'm going to educate Johnny in District A who has no special needs, no underlying issues that he's dealing with at the same cost that I may have to for a student that has high needs. So we really are looking for a funding structure that will continue to support the needs of the student, and the money will be there to ensure that they have the resources that they need to be successful in their environment.
Dr. Tina Kerr with us here on the Megacast. She's the executive director for the Michigan Association of Superintendents and Administrators. We are seeing one issue that some of the school districts are facing right now of shortage of employees, teachers and bus drivers and so many other employees as well. What do you think that's looking like this school year into next?
Well, this is not a new problem. This is a problem that's been an issue for the last couple of years. At MASA, we put together district leaders from around the state to focus on educator shortage. Now, the educator shortage has compounded into substitute shortages and principal shortages, and now we're seeing a significant number of shortages in the superintendent position as well. So we have to be creative, and we've been in partnership with MDE, who's been very instrumental in trying to reduce some of the barriers that exist in encouraging young people to get into the field of teaching. And we work closely with the Michigan Education Association, the AFT. We all are trying to do the same thing, and that is, how do we attract young people to this profession? And what do we need to do to ensure that it is a profession that they can be proud of? The conversation around education has not always been positive, and I think the pandemic has showed families that they need their teachers. They don't want to be homeschool teachers. And so we've worked really hard to try and be creative. You're seeing lots of new cadet programs and a lot of innovation around the state with our districts. How do we grow our own? How do we start to put people in these positions? Because it is a major problem, and it's only going to continue to compound.
And you add to that, too, trying to diversify your workforce as well.
Absolutely. Again, equity issues exist in our workforce also. We need to be thoughtful in how we recruit and how we retain educators into the profession, for sure.
So is there some type of program or some thought being done to come up with a substitute program? So maybe, someone went to college and has a degree in business, but yet not in teaching. Is there a program or a way for them to get certified but not go back to college?
Absolutely. That is one of the areas that we've been, as I said, Michigan Department of Ed has been very instrumental in how do we reduce those barriers. So you have a highly qualified business person that maybe has a math background. What do we have to do to ensure that they could go be a math teacher? We still have to get into the pedagogy and help support them of what learning looks like in that math classroom, but their experience and their expertise is something that they already have. So how can we expedite those? You've seen Detroit Public Schools is doing a very similar type grow your own program. We've seen a lot of parapros who may have only had their associate's degree going back and doing programming with different universities in partnership with universities and college to expedite them to get to that teaching certificate. Everyone is trying to work together and is really trying to be very innovative in how do we encourage people that may have never thought they could go be a teacher because they had to spend a year of student teaching or had to take a set number of classes. Those are the types of barriers that we're trying to reduce to ensure that we get the workforce we need moving forward.
One thing, as you were saying, with the pandemic, there are conversations that are being had with so many different groups, especially some of the unions, who, let's say if this was 2 years ago, these talks would have been off the table.
Absolutely. Our union leaders have been tremendous partners, and they understand we have a problem. It only helps all of us if we work together to ensure that we can fill these positions. Many of our positions were unfilled 2 years ago, and now it's just gotten even worse during the pandemic. So it takes all of us working together in one effort to try and build back our educator workforce.
Dr. Tina Kerr with us here on the Megacast. She's the Executive Director for the Michigan Association Superintendents and Administrators. Boy, what a year it's been with the lawmakers as well. Everyone has their 2 cents in this issue about remote learning, taking kids, putting them back in the classrooms, not in the classrooms. How does that conversation go in Lansing with your organization?
Well, first and foremost, I have to commend all our districts and all our members across the state. This has been a tremendous challenge, and everyone is working so hard to try and ensure that our students are getting the appropriate education. If I look back last year in March, we were scrambling. Everyone was trying to figure out, what does this look like? Our poor teachers were, I haven't had to deliver this lesson, remotely. How does that look? How does that change? But everyone really dug in. And if you think about, we didn't have a summer this year. It was every district was working so hard. And as we look to the fall, many of our districts in the state were able to come back, and some have been operating since September. It just depended on their particular area and how the virus was being contained. And I will say that they've been doing all this under a tremendous amount of pressure from the public. Everyone wants the kids to go back to school. Every educator wants them to go back to school, but safely. And so we have to remember that this is not a one-size-fits-all. We have to put all kids back at a certain day. We have been very strategic in how we encourage and help support districts to bring their students back. So it has been a challenge, but they've risen to the occasion, and I think we're in such a good position moving forward.
Well, let's hope so. And it's like you said, it's like they couldn't win with some people, but what's happening in my household may not be what's happening in your household. And so there is no one answer for every family out there. But like you said, I think so many parents now appreciate not only our educators, but also all of the members that work for the school district, because it takes everyone working together. Some of these bus drivers are working crazy hours right now with the hybrid situation going on.
Of our support staff have worked way outside their job descriptions. Bus drivers becoming food delivery, bus drivers becoming a hotspot for internet, parking buses in neighborhoods. Our kitchen staff now, they're delivering or they're putting together lunches to make sure that they get students fed. Everyone has just gone above and beyond their original expectation for the position, and they've done it sometimes at their own risk of safety, and they've just put the kids first. And our front line in education has just really answered the call to support our kids, and we'll keep doing that for sure.
Well, we are also appreciative of all of their efforts, because we know they have been working around the clock for the past year now. Dr. Tina Kerr with us here on the Megacast. Just another minute or two here with you on the show before we try to take the governor's press conference. Anything we didn't add that you want to share with our listeners and viewers before we say goodbye?
I just want to add that one of the things we're doing at the association is we're shifting to post-pandemic. It's time now for us to move forward. What does the new educational landscape look like? We've assembled over 50 administrators, 20 partners. We've got a work group of over 75 people that have come together. What would promising practices look like in classrooms moving forward? What would extended learning look like? How do we ensure educator evaluations are still a productive way of analyzing how our students are doing? And then the biggest thing that we've also focused on is social emotional learning. This pandemic has definitely hurt our students and our staff. And so this work moving forward, it's time for us to shift gears and turn the page. And what does education in Michigan look like post-pandemic?
Oh, and no easy answer there. So it's going to be a lot, just like this past year, trial and error.
It absolutely is. It's a heavy lift, but everyone is committed to ensuring that we don't go back, that we create what our new normal will look like for kids moving forward.
Well, and lessons learned during all of this as well. Let's hope we come out stronger and better on the other side.
I have no doubt we will.
Dr. Tina Kerr with us here on the Megacast, Executive Director for the Michigan Association of Superintendents and Administrators. We so appreciate your time this morning and hope things are going well there in your new position.
Thank you so much, and I appreciate being here.
Happy 2021 to you. Let's hope it's a little bit calmer.
Me too.
Thank you again for your time. We're going to take a quick break here on the Megacast.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together. Together. Together.
For the latest information, visit oakgov.com/COVID.
COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. We want to go ahead and join in the press conference taking place right now at Ford Field in progress. Speaking now is a representative for the Detroit Lions.
As a site where we will build one of the nation's first community vaccination sites to service the entire Southeast Michigan region. It's hard to talk with a mask on. The vaccination clinic we are hosting is a great demonstration of partnership amongst federal, state, and local government. Equally important, this is a partnership with the private sector with the involvement of our partners at Henry Ford Health Systems and Meijer. We are privileged to work alongside them and be part of this. Game day at Ford Field was not the same last season without our fans. We know the passion of sports fans in Detroit, and they are eager to be able to root for their teams in person and do so safely. We plan to be ready for football and fans in the fall, and we are committed to do whatever we can to support the vaccination efforts to make that possible. Thank you very much. Now it is my honor to introduce the Lieutenant Governor of the great state of Michigan, Mr. Garlin Gilchrist II. Lieutenant Governor.
Thank you, Mr. President. It is an honor to be here today. It's an exciting and important day for the state of Michigan. I want to thank our Governor, Gretchen Whitmer, who I'll be turning the podium over to after a few brief remarks. And I also want to thank all of the partners who came together to make this day and to make this vaccination site possible. Partnership will pave our pathway through this pandemic. At the start of the COVID-19 pandemic, Detroit was one of America's epicenters for cases and deaths. And as a Detroiter, I felt this personally, having said goodbye to 27 people due to this virus. The virus hit our city hard, but Michiganders are tough. We're tough, and we can come together to combat COVID-19. We pushed down our curve, and we stepped up to help one another. And today, right here at Ford Field, Southeast Michigan becomes a symbol of hope. The Mass Vaccination Center is a sizable step forward towards Michiganders returning to some sense of normalcy while actively saving lives. This project at Ford Field will mark the largest on-site inoculation effort in the state of Michigan. That is something that Governor Whitmer and I are extremely proud of. Throughout the pandemic, I've been honored to chair the Michigan Coronavirus Task Force on Racial Disparities. Here in the city of Detroit, the Racial Disparities Task Force was very focused on increasing mobile testing and access to masks. We wanted testing to be simple and an accessible process for anyone in need. Because of the task force's work, 1,000 vaccine doses per day will be allocated from this site to mobile vaccine units that will literally take vaccines to people in communities throughout Southeast Michigan. Governor Whitmer and I are taking every step possible to ensure that everyone who wants a vaccine in Michigan will have access to a vaccine without any hoops to jump through. The work that has been done through the task force, it helped lay the groundwork for this project that we're announcing today. Ford Field was selected using the CDC's priority tool, which ensures that our most vulnerable populations have close access to receiving a vaccine. And by selecting this location, we are breaking down barriers to vaccines. So please, sign up for your vaccine appointment today by texting END COVID to 75049. Throughout this pandemic, we've seen everyone come together, from businesses to community members. This operation, again, is a great example of how when we work together, we can reach our highest heights. I especially want to thank the Detroit Lions, the Ford family, Meijer, the City of Detroit, Henry Ford Health System, Wayne County, and our federal partners at FEMA. Your bold partnership is allowing us to distribute these vaccines equitably and fairly in Southeast Michigan. And all of this would not have been possible without the Biden-Harris administration. President Biden and Vice President Harris have been incredible partners and leaders, and Michiganders are in a much better position to get through this pandemic because of their leadership. The Protect Michigan Commission, which I'm also humbled to co-chair, has been a critical part of this effort as well. The commission comprises of a diverse group of leaders from across the state of Michigan. We're working hard to make sure that every Michigan resident has the most up-to-date information and resources about the safe and effective COVID-19 vaccines. The commission remains focused on protecting Michigan residents' health and safety by educating communities about the effectiveness of all approved COVID-19 vaccines to eradicate the spread of this coronavirus. I continue to have conversations with family members, with friends, with neighbors about the vaccine, about its safety, and about its effectiveness. People have questions. It's okay to have questions. We must also recognize that those questions have answers. And we are doing everything we can to get people those answers from resources and from people who they trust. We have plans to invest in ensuring that we address and eliminate disparities in vaccine uptake, building upon the work of the Racial Disparities Task Force that we've been leading for the last 11 months. So to everyone watching at home or here in person with us today, I want you to keep standing tall for your community and for the state of Michigan, because together we will overcome COVID-19. Overcoming is what we do as Michiganders and as Detroiters. To my fellow Detroiters, to help us overcome, we need you to become a vaccine ambassador. You are the best messenger to the people in your life to get them to make the choice to get vaccinated. Because when we see obstacles, we overcome them. When we see challenges, we overcome them. We invent, we innovate, we partner, and we overcome. This vaccination program is a testament to how when we all come together for the common good and with a common purpose, we can make things happen in real time. Thank you so much for being here today, and I look forward to everyone being vaccinated here at this site. And it is now my honor to pass this podium to the Governor of the State of Michigan, Gretchen Whitmer.
All right, well, thank you, Lieutenant Governor Gilchrist. I am so pleased to be here. Good morning, everyone. This is a great day, and this is a fantastic announcement with our partners here at Ford Field, the City of Detroit, Wayne County, all of the counties surrounding the area. This is going to be a huge moment for us. So thank you for hosting us, and thank you for joining us in this important effort to the whole state of Michigan. As Lieutenant Governor said, this Ford Field site will administer 6,000 shots a day starting March 24th, and it'll continue for 8 weeks. That's 6,000 extra shots a day, totaling over 335,000 additional doses over the next 8 weeks. This site will build on the incredible progress that we are making statewide. To date, over 3 million doses have been administered, and that number is literally growing as we speak. 6 in 10 Michiganders who are 65 and up have been inoculated, and 1 in 4 Michiganders over the age of 16 have received their first doses, including right here in Metro Detroit. As I've said before, the vaccination process is like a locomotive. Right? It is slow and cumbersome and frustrating at the beginning, but it is picking up speed and getting smoother, and we are rolling here in Michigan. The vaccine train has officially left the station, and it's moving toward our shared destination of vaccinating 70% of Michiganders 16 and older. So our work continues, but we're doing better every single day, and this announcement is going to be an important part of our mutual success. I'm really thrilled that Ford Field was selected to be one of the first federal community vaccination sites in the country. State government can't tackle this pandemic and the vaccination drive alone, which is why we're so grateful for partnerships that make this site possible. First, let's applaud the heroic effort of our frontline healthcare workers and volunteers here at Ford Field and statewide. We should applaud our Michigan National Guards women and men who also are helping statewide. We are administering tens of thousands of vaccines every single day in Michigan. And I want to thank the Detroit Lions and their incredible leadership team. We are so grateful for your partnership as well. Now, the Lieutenant Governor mentioned recognizing Meijer. Now, we all know Meijer is a staple of daily life in Michigan for many of us. We appreciate their help on the vaccination drives here and in their stores across the state. And when I was reviewing my remarks this morning, I went online and signed up my 17-year-old so that she's officially in the queue when she as an asthmatic can get inoculated starting next week. And I encourage everyone else to do it, so it's incredibly easy. I have to express my gratitude to Henry Ford Health Systems as a critical partner in our efforts to date, and of course with this announcement today. And this is complementing the efforts that are already being undertaken in Wayne County with the leadership of Warren Evans, in Macomb with the leadership of Mark Hackle, and Oakland with the leadership of Dave Coulter, and obviously here in the city of Detroit with Mayor Duggan. But we know that we wouldn't be here if we didn't have real partnership from the federal level as well. And that's what we are so thrilled about with President Biden's leadership in the White House and the ambitious goal of 100 million shots in 100 days already achieved well into this third month of his administration. So 100 million shots in arms and checks to over 100 million families is what the Biden administration has delivered on, and we are grateful. So we continue to ramp up vaccinations, and I know that the goal of being together for 4th of July, having a barbecue celebrating the independence of our nation, is a realistic goal where we can get together, and that's one I am certainly looking forward to. So the way to get there is to continue doing what we're doing, ramping up vaccinations, being smart in the interim by wearing our masks, social distancing, washing our hands. We know that 3 safe, effective COVID vaccines, 2 of which have a presence already in Michigan in terms of being developed here in Michigan. This is the key to our ultimate success. So if we want to get back to normal, which I know we're unanimous on that front, we all need to get vaccinated and encourage our loved ones and friends and coworkers, neighbors to do so as well. So to use some sports analogies, I can't help myself being in Ford Field. We are in the 4th quarter of this fight against the vaccine. It's not over yet. It is no time to spike the football. It is time for us to grit our teeth and keep doing the work we need to do until the last second of this event plays out. We have incredible partners, and we are going to be successful. So I am thrilled to thank FEMA for your incredible work here, the partnership that you see, Meijer and Henry Ford and Ford Field. We're so grateful. We'll continue to work together, and we're going to get this done. So with that, I would love to turn this over to our great federal partner from FEMA, Region 5 Acting Regional Administrator, Kevin Sly Sr.
So good morning. Thank you for joining us as we update you on the opening of the Ford Field Vaccination Center and provide some important information about the site's operations starting next week. This site wouldn't be possible without every level of government, along with key private sector partners working together towards a common goal of increasing COVID-19 vaccine access to Michiganders who need it the most. I want to thank the Department of Defense and our federal interagency partners such as HHS and the CDC, Governor Whitmer, Lieutenant Governor Gilchrist, as well as our partners at the Michigan State Police, most notably Captain Kevin Sweeney, Wayne County, and the City of Detroit. And thank you to the Detroit Lions team president and CEO Rod Wood and the entire Lions organization. Meijer CEO Rick Keys and his team, and CEO Wright Lassiter and the Henry Ford Health System staff for their critical role in making this vaccination center a reality. The opening of this center reflects a truly successful public-private partnership. The federal government is committed to the equitable distribution of vaccines. The decision where to locate this site and accompanying mobile units included local input and public health data such as the CDC's Social Vulnerability Index, other census data, and localized considerations such as the existing deployment of resources and feedback from the state's public health experts. Ford Field not only provides the necessary space and structure to administer up to 6,000 doses a day, but is also a prominent facility within the Detroit area, uniquely suited to support the disadvantaged and medically underserved populations here in the city, while accessible using numerous transportation options. To get the facility ready, the Lions organization has utilized the concourse areas, which will be set up with vaccination stations or pods, registration areas, and waiting areas. The setup will allow for an easy flow of individuals through the process, starting with check-in and ending in the observation stations. FEMA will be coordinating federal personnel and providing financial assistance, equipment, and supplies for the site at 100% federal cost share. In addition to other medical and non-medical staffing, a 222-person Type 1 team from the United States Air Force will provide vaccination support. These medical and support personnel will be a key part of this operation, and we're grateful, totally grateful for their assistance. Vaccines for this center and mobile operations are also being provided to the state above and beyond the regular allocations and will not affect the supply of ongoing vaccine distribution efforts in Michigan. This past year has been devastating and difficult for our entire nation. The battle against this virus has made us all weary, but there's hope. Hope that we can very soon put this pandemic behind us and move forward. The key to that brighter future is the vaccine. Now I'm going to deviate a little bit from my prepared remarks. I want to add a little bit of a personal note. As an African American here in the United States, my grandmother, my mother, my twin sister, my uncle, and several of my cousins over the past year have contracted COVID-19. It was a trying time for the family. We were lucky. Every last one of them made it through it. But it made me think, as an African American myself with 3 comorbidities, to really think hard about getting the vaccine. Well, I chose to get the vaccine. I got the vaccine in January and February back in Chicago, where we're based out of. I chose to live when I made that decision. We all need to make the choice. We all need to get beyond the pandemic, and hopefully everyone will get the vaccine, especially our disadvantaged populations and our medically underserved communities. I will now turn it over to Meijer President and CEO, Rick Keys. Thank you.
Thank you, Kevin, and thank you for your support and your powerful message. On behalf of Meijer and our 75,000 team members, I'm very proud to be here for such an important announcement. In early January, we were honored to be named a federal retail pharmacy partner to the state of Michigan by Governor Whitmer. This action allowed us to quickly mobilize our teams and begin this immensely important mission. The state's message was very clear to us: move fast. Since then, our Meijer pharmacy and store teams have administered more than 225,000 COVID-19 vaccines to Michiganders, and a total of 350,000 vaccines to people and communities we serve throughout the Midwest. We've been able to do that by leveraging an online registration system that to date has allowed us to register more than 1.8 million people for vaccines. We're excited to bring that technology, as well as our pharmacy and IT teams, to support the state of Michigan and FEMA in this critical and ambitious effort here at Ford Field. Our call to action is simple: register. By simply texting "End COVID" to 75049, people can quickly register to attend a vaccine clinic right here at the home of the Detroit Lions. People can also register online by visiting clinic.meijer.com. Again, it is a very simple process, and I was happy to hear that that went well for you this morning as well. We look forward to vaccinating your daughter. In fact, we registered 40,000 people in the first 24 hours after opening the registration process earlier this week for these clinics. And as of this morning, that number has increased to 65,000 registrations. Those numbers are very encouraging. Now, if someone has already registered to get a vaccine at a Meijer Supercenter, but they want to sign up for the Ford Field clinics, they will need to register a second time because it's a separate registration list. The good news is they won't be bumped out of the general Meijer registration bank, and they can choose the first appointment that becomes available. As a Michigan-based company with stores throughout the Midwest, our goal is to utilize our stores, our teams, and our resources to enrich lives in the communities that we serve. Our teams have come together to lend a hand during this challenging time, but the work is not done yet. Through this continued partnership with the state and FEMA, we'll be able to register, schedule, and process tens of thousands of Michiganders for vaccines in the coming weeks. We are very pleased to be able to be doing our part to finally put an end to this pandemic. Thank you very much. We appreciate your trust, and we look forward to serving our role in this clinic. Now, let's hear from our friend at Henry Ford Health System, President and CEO, Wright Lassiter.
Thank you, Rick. Good morning, everyone. Henry Ford Health System is excited to serve as the health system partner for this mass vaccination clinic at Ford Field, and join with our local, our state, and federal partners to accelerate Michigan's efforts in getting vaccinations in people's arms and moving closer to ending this pandemic. Certainly want to express our thanks to the Lions organization and to the Ford family, to Governor Whitmer, Lieutenant Governor, to our FEMA representative, and to our partner at Meijer for their efforts thus far. As the official medical director for the site and a trusted healthcare leader, we bring to this partnership highly skilled expertise in disease management, in infectious diseases, and in vaccine management. We were one of the early users of steroids to treat patients, and that treatment made a critical difference in patient outcomes for Michiganders. We've also documented proficiency and command for standing up mass vaccination sites of our own. And we've been operating multiple vaccination sites throughout the region for the past couple of months. Our sites are operating with seamless proficiency and have the combined capacity to vaccinate between 4,000 and 5,000 people each day based on vaccine availability. We're sharing our best practices here with our support partners to ensure that people who come to Ford Field have a safe and seamless vaccination experience. Henry Ford's skill at mobilization, at operations, and logistics was also displayed in a similar leadership role with the TCF Relief Hospital between April and June of last year, making Henry Ford an ideal partner to meet the needs and demands of what will be required here at Ford Field. At this time, I'd like to acknowledge and thank members of our Henry Ford Health System team who are serving in leadership roles for this vaccination site and this community outreach effort. I'd like to acknowledge Dr. Stephen Rockoff, who is the Service Chief of Emergency Medicine at Henry Ford West Bloomfield Hospital. I'd like to acknowledge Valerie Gunn, Director of Regional Ambulatory Operations for Henry Ford Health System. I'd like to acknowledge Rox Katia, Director of Pharmacy Services at Henry Ford Hospital. And last but certainly not least, I'd like to recognize Dr. Sam Masalam. Dr. Masalam is the Vice President and Medical Director for Henry Ford's international initiatives. He also serves as the Incident Command Leader for our Vaccination Incident Command Center. And Dr. Masalam and Rox have been instrumental in planning and executing our vaccination program at Henry Ford Health System. So join me in thanking them briefly. Thank you. With the capacity to administer 6,000 doses of vaccines per day, the Ford Field site can make a significant difference in vaccinating our most vulnerable and underserved populations who were hardest hit by COVID-19. When the pandemic hit and there were no FDA-approved treatments for COVID-19, Henry Ford made it our mission to use our experience and our expertise in research to identify the most effective care strategies. As such, we were especially proud to to work as a study site for testing the efficacy and the effectiveness of 2 of the 3 vaccines that were ultimately approved under emergency use authorization by the FDA, the Moderna vaccine and the Johnson & Johnson vaccine. For each of those clinical trials, Henry Ford was successful in enrolling the largest number of people of color of any study site, and now those same vaccines are being administered here in the state of Michigan. Since the start of our vaccination program on December 17th, we've administered about 170,000 doses of vaccine, and more than 73,000 people have been fully vaccinated as a result of our team members' efforts. We expect that number to increase exponentially as more vaccine supply becomes available to the state of Michigan in the coming weeks. As part of our robust vaccination program, we are administering vaccinations at multiple sites across Southeast Michigan each week through partnerships with places of worship, community organizations, and schools. Our mobile vaccination efforts are serving communities of color with vaccine hesitancy, as well as essential workers and populations that may have technology barriers and other barriers to access and schedule appointments. In closing, as we see the light at the end of the tunnel in this dark pandemic period, we must remain vigilant with our safety measures for just a bit longer, as the governor said. When you become eligible, please register to get your vaccination and encourage your family members to do the same. And also, please continue to adhere to our CDC guidelines regarding mask wearing, social distancing, and avoid large gatherings and frequent hand washing. And if you need a mask, I think the Detroit Lions organization has pretty cool masks available for you. And if you don't have a Lions mask, you can always defer to a Henry Ford Health System mask. Thank you very much. It's now my pleasure to hand off the podium to Carrie Ebersole Singh with the Project Michigan Commission. Carrie, thank you very much.
Well, I have the great honor of wrapping us up today, but as you can see, today's event is a symbol of the team that has to come together to defeat COVID. And it's tremendously exciting as we start to turn the bend on getting vaccines in arms across the state. So the Protect Michigan Commission was appointed by the governor. We have about 97 members, a ton of work groups, and we're working across communities to raise awareness about the vaccine, dispel any myths, and help educate folks on where the access points are in their community to get vaccinated. And I can say we are picking up steam every day, and this Ford Field Community Clinic is going to be an important part of us continuing to do so. We have had actually 33 days of the last 6 weeks with over 50,000 shots in arms a day, which is our initial goal, to hit that per day. So that's tremendous. March 11th, we hit 90,000 shots in arms on a single day, which is amazing. And we're just going to keep at this until we get all Michiganders 16 and above vaccinated. So my last thing, positive news, Meijer, right at 11, is sending out the first appointments to be scheduled based on the registrations today at 11. So those invites are going out, and I just want to remind folks, for viewers at home, answer your phone. Some of you selected that you wanted to schedule by phone. People will be calling you, and it may be from an unidentified number, so pick up those calls, don't screen. We are calling to get your vaccination appointment scheduled. So again, I think this is an amazing opportunity and just so exciting for our state. And I got to tell, I know the governor likes to tease me every now and then about some of the projects I get to be a part of, but I can definitely tell you this is the most important work of my career. It's an honor to be a part of it, and we got to build the team across the state to get this done together. So thank you all. And for media, we will have several folks being able to handle questions on a one-on-one basis. So at this point, that concludes our program, so thank you.
And that is all from Ford Field, of course, the mass vaccination site there, a partnership between the Federal Emergency Management Agency, the state of Michigan, the Michigan Department of Health and Human Services, Meijer, the Ford Company, the city of Detroit, and so many others in our local area to get people vaccinated. As was just said from one of the speakers today, Meijer will begin scheduling those appointments at Ford Field at 11 o'clock. It is 11 o'clock, so those are starting to go out now. And if you signed up to answer, to get scheduled by phone, make sure you answer the call, as she said, and do not screen that phone call. Ronnie.
So one of the things that kind of came out of this, it's going to be 6,000 doses per day for 8 weeks. Now, this is above and beyond the number of vaccine doses that will be distributed to the state of Michigan. 5 of those doses will be administered at Ford Field. 1,000 other doses per day will be administered and distributed throughout what they're calling mobile clinics. So they will be going into the neighborhoods. Here's a couple things you need to keep in mind. If you did sign up through the Meijer, but not through the Ford Field initiative, you need to go ahead and re-sign up for both. So you can then, and how you do that, there are a couple ways. You text in COVID to 75049. You can also call the Michigan Department of Health and Human Services. That hotline is 888-535-6136. But you can also visit online clinic.meijer.com/register/CL2021. I did register as someone earlier this week. More than 65,000 people have already registered, and you can't really just punch it in. You need to go ahead, find that online link, and click on it, and you can register in that regard. But again, more than 6,000 shots are going to be administered throughout the region starting on the 24th. So some good news for the state of Michigan.
Yeah, great news for the state of Michigan. And if you have not, if you were not able to record the information that we just gave you about signing up, it is on our website. We did have an article just a few days ago when the registration for the Ford Field vaccination clinics did open all the information about signing up through all three options, the online option, the text option, and the call option. Those are all on our website, civiccentertv.com/coronavirus.
We're going to take a quick break here on the Megacast. Our apologies to Suzanne Levine with the Greater West Bloomfield Chamber of Commerce. Due to the press conference, we will be getting her on the show later this week, but instead we'll continue on with the show when we come back after the break. Dr. Gerald Hill and Kyle Anderson, the Superintendent and Assistant Superintendent of Business and Operations for the West Bloomfield School District, will be with us to talk more about the proposed millage. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Thank you for taking time out of your day to be with us here on the Megacast, the 1-year anniversary for this show. And as you all know, it did grow out of the pandemic. They thought it was just going to be for a couple of weeks to try to bring you the latest information. A year later, we are still here, still working to bring you information because it changes daily. And as you just heard from the press conference, which went on for 30 minutes there at Ford Field, we will be starting to get more vaccinations here in the state of Michigan. So that vaccination effort starts at Ford Field on March 24th, but you need to go ahead and register now. With us, though, we are going to change the conversation just a little bit. We are going to bring in Dr. Gerald Hill. He is the superintendent, of course, over at West Bloomfield School District, and Kyle Anderson, the assistant superintendent of business and operations. But if Dr. Hill, if we can start with you, thank you for being with us.
Thank you, Ronnie. You've had a busy morning, I see.
Well, it's a little bit easier than the old days because we can now take it live via technology. You don't have to actually go down to Ford Field and set up all the equipment. So a little bit easier today. So before we jump into the millage proposal, any new updates going on over there at the school district?
Well, we've been in the process, as you're probably aware, of talking about our return to learn plan within the school district, and we've had several board meetings, 3 of them since during the month of March, where we talked about different options that we're exploring to open up more fully, and we'll be making a final determination at Monday night's board meeting, the 22nd. We've heard from the elementary group, high school, and the middle school groups, and we're processing that information, and I'll be making a recommendation to the board for Monday evening.
Do you want to give us that recommendation now?
I don't want to preempt the. Usually, good practice for a superintendent is to inform the board first and go from there. So.
Well, that's okay. We'll take the information first. We don't mind.
Take it off your hands. Yeah.
Well, we do know that the big talk for so many people here locally has to do surrounding the upcoming millage proposal. So if we can bring in Kyle Anderson, the Assistant Superintendent of Business and Operations, can you explain to us the difference in this millage proposal?
Absolutely. Thank you, Ronnie. Appreciate you inviting us and having us on your megacast. We're asking voters to restore our 18 mil non-homestead operating millage back to 18 mils, which was what originally was approved by voters back in 2014.
So
and that's the question.
So why did it go away? Did it just expire? They're only good for so long?
Well, that's a good question, Ronnie. It's been reduced by what's called a Headley rollback over the last 6 years. To the point where it's 16.9 mils today, and we're simply asking voters to return it back to 18 mils.
So I learned something new on this show each and every day, but for our listeners and our viewers, can you talk more about the terminology non-homestead millage?
Absolutely. Non-homestead millage is applied to properties that are businesses, commercial property, rental properties, second homes. They are not applied to primary residences. So for anyone owning a primary residence in our district, this millage rate is not applied to your property.
So, but as a homeowner and as a voter, then we would still get to vote on it.
Absolutely, you are 100% correct.
With that too, though, you look at some of the business owners, they may not live in this area and they could be directly impacted, but they won't get to vote on it if they're not living in the area, right?
Yeah, it's only residents of within our school boundaries are voting on this measure on Tuesday, May 4th. You are correct.
And well, how do you go about trying to figure out the best time to get it on a ballot? What's that thought process?
Well, this one was fairly simple in that regard, Ronnie. We went in May because we do 100% of our tax levy in July of each year. So we wanted to ask voters this question so we could impact the 21-22 school year. Instead of going, say, in November, we would have missed that opportunity. So it's a very good question. Thank you.
So Superintendent Hill, if we can bring you back in, Dr. Hill, what would this mean for the bottom line for the budget for the district?
Well, for the 21-22 school year, since we do collect our revenue in the summer, it would mean approximately $691,000 of additional revenue for next year's budget. What's happened over the years, it incrementally gets rolled back by this Headley amendment, and it's reached a point where it's now a pretty significant revenue for the year. So Mr. Anderson researched the issue and brought it to the board, and the finance committee of the school board, and the finance committee and the board concurred that it was proper timing to go for this millage.
So you're also struggling, still managing the pandemic. How do you try to explain this and get it out to the public at a time when we're still in a crisis mode dealing with the COVID-19?
Well, that's a good question, because it's hard enough to understand in and of itself, let alone all these other issues swirling around. But I think we've done a lot of work in terms of putting together fact cards, recorded presentations, and trying to make the rounds in the community so people understand what this is. Most school districts in our position are faced with if you're facing a Headley rollback, you want to make sure that you're garnering all the revenue that you're entitled to from the state, and this is a prudent and smart financial situation for the board to look into and act on.
This is as someone who has covered some of these millages for years, this is the first time I'm hearing of the Headley Amendment. And so, again, I learned something new every single day when I do this show. And but you also, a lot of the general population, they're probably not aware of this as well. And so you're having to back up and explain it, but also try to encourage them to try to get this money at a time when so many students are still remote as well.
Yeah, and revenue is an important resource for us, obviously, as we're teaching our students. So it is an important strategy, if you will, to make sure that we're leveraging all the resources that we're entitled to leverage. And so this is one example of that. One thing I want to point out is that the money that we'll be receiving it's operational money. It's not to build a new school. It goes into the teaching and learning portion of our budget. And at $691,000, if you know that can equate to close to 12, 13 teachers just as a comparison. So it's important revenue.
And with that, do you think, though, some parents will support this even more so than maybe before because they've come to value so many of our educators, during this pandemic?
Well, that's a great point. When we look at, and we talk to our teachers, one of the things we're learning through the pandemic is that we've divided our classrooms in half size-wise to do the appropriate social distancing, et cetera. And so when students come to the classrooms, we're having, instead of 26, 13. And that's a major difference. Even the time may be shorter, but the quality of the time with the teacher and the interaction is better because the class sizes are smaller. Our class sizes, in some cases, like in the middle and high school, they're 30, 35 students. And so that gets to be a monumental task. And so parents having had this experience of if you have 2 or 3 children at home and you're struggling to keep up with their Zoom lessons or Canvas lessons, I think there's a much greater appreciation for the job that teachers do. But our teachers are seeing the impact of having fewer students in classes, benefiting how they're able to work with the students that are there. So any kind of revenue like this where we can impact the class size in the schools is a benefit for teaching and learning.
Dr. Gerald Hill joins us on the program, as well as Kyle Anderson, the Assistant Superintendent of Business and Operations from the West Bloomfield School District. Upcoming proposal on the May 4th election ballot regarding increasing a 2 mil increase in the non-homestead millage rate for the school district. And just to inform our audience in West Bloomfield, there are 6 school districts in West Bloomfield among the voters. The only voters that will be voting on this proposal in May are those that live in the West Bloomfield School District. So those that are in the Birmingham School District or Bloomfield Hills will not vote on this. And if you have any questions, call the West Bloomfield Township Clerk's office, and they can help you understand whether or not you need to be voting in or are eligible to vote in this upcoming millage election. So Dr. Hill or Kyle, was this millage going back to a vote to increase the millage back to the rate it was before the Headley Amendment? Was this something that was decided in the wake of the pandemic because of the financial issues that schools are facing? Or was this something that was planned by the school district as something that was upcoming even before COVID-19? What impact has the pandemic had on the decision to bring this back to the voters?
I think there's a greater sense of urgency to make sure that we have the revenue that we are entitled to, but good business practices, as Mr. Anderson would state, would suggest that we would do this anyway. So it's not caused by the pandemic. It's more, it happens to coincide with the pandemic that we're in right now.
Dr. Gerald Hill and Kyle Anderson with us on the Oakland County Megacast. They're speaking about an upcoming Headley Amendment rollback, increasing the ballot proposal increases a 2 mil increase on the current millage for the school district, returning it to the 2014 level. Dr. Hill or Kyle, just a couple more minutes with you before we'll let you go. Is there anything else that would be important for the people of the West Bloomfield School District within the voting area to know about this amendment? And if so, where can they find more information or ask you and others in the school district questions?
Go ahead, Kyle.
Yeah, I would add, thank you, Tyler. So we've created a section of our website dedicated to this election that it contains a wealth of information. There's one document in particular. It's an FAQ document. If it's an easy read, and it walks the reader through all the issues surrounding this ballot proposition. We have a document that demystifies the ballot language, explains it in more detail in an effort to make sure that our voters are well informed. And you could also contact your building principal and also call me directly. I would love to chat with anyone in the community about this very important ballot initiative.
So, Dr. Hill, if I can ask you, I was on your Facebook page a little bit earlier today, the drone video of the construction over at the new middle school is so cool. That has to be exciting. When's that project going to be wrapped up?
Well, we're planning to open in the fall of 22, and pretty soon the public will be able to see better from the street because we've approved a contract for demolition of the current Orchard Lake Middle School that's sort of blocking the view. But that drone video, our architect and construction team, they do that regularly to keep the public informed. You can see it on our Facebook page, and so it's a great.
You're an important man. Your phone's ringing.
Yeah, I got to turn that off.
That's okay. We've all been there. The drone footage, though, if anyone hasn't seen it, go to the West Bloomfield School District's Facebook page. It's posted there. It's pretty cool.
And we took a tour inside the building, which is not available, obviously, for the public, but the board and Mr. Anderson arranged it. And the building is definitely taking shape. They're on schedule. You can see the elements, but from that drone video, that wave that's on the rooftop is very dramatic, and that was an element that we wanted to carry over from the high school design, that wave in front of the high school. And so we put an interesting design on the rooftop, and it really is quite dramatic looking. We're excited about it. Bottom line is, when this building is finished, it'll be a state-of-the-art, up-to-date teaching and learning facility for our grades 6, 7, and 8 students, and it'll be right on Orchard Lake Road, so it'll be a great addition to the community of Greater West Bloomfield. Our students and community members can be proud to have it there, and I can't wait to see students and teachers in it.
I think so many people will say that as well. Any changes to the plans because of COVID? Like more, having various spaces, spread out a little bit more, anything of that nature? Or were these plans pretty much already in place and it's too costly to change it this late in the game?
It's sort of interesting the way that worked out. We did not have COVID in mind and pandemic in mind when the design was built, but the design is rather flexible, and there are a lot of open spaces. And the way the classrooms are arranged around a pod, we would be able to socially distance to some extent, depending on how many students we have. But it's laid out in such a manner that there's a lot of flexibility in the teaching and learning spaces within the school.
Well, we all look forward to when that school building actually does open as well. Dr. Gerald Hill with us, Superintendent for the West Bloomfield School District, and Kyle Anderson, the Assistant Superintendent of Business and Operations for the district as well. We want to say thank you to the two of you for your time this morning. We always appreciate it.
Thank you. We enjoy being here. And again, thank you for the service that you're doing for the community. It's an invaluable contribution to keeping everybody informed what's happening.
Thank you. Thank you. We appreciate that. Hopefully, though, the pandemic will be over soon.
Yes.
We're going to take a quick break here on the Megacast, and when we come back, we are going to be speaking with the co-founder and CEO for Brown Dog Creamery. This is the Oakland County Megacast.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
Great to have you with us here on the Megacast. As a reminder, you can always catch Tyler and I here in the studios live Monday through Friday, 10 a.m. until noon. You can watch and listen to us on Civic Center TV, Birmingham Area Municipal Access. Also, Channel 15, if you have Comcast, 99 on AT&T. You can listen to us on the radio as well. Just tune us in, 89.3 Lakes FM, 88.1 FM The Biff. And then today we are also live streaming today's edition of the Megacast on the West Bloomfield Township Clerk's Office. So we want to say thank you to them. We have a sweet treat for you here on the Megacast.
Yes,
today. Our next guest, Paul Gabriel, joins us. He's the co-founder and CEO for the Brown Dog Creamery. Great to have you with us.
Thank you. Thank you for having me.
So the first thing I have to ask, where's the doggy?
They're actually under the desk right now.
So you do have four-legged coworkers.
Oh yeah, for sure. If you might hear barking if somebody rings the doorbell or something, so I'll apologize for that in advance.
That's okay. We've all been there. So, Paul, if you can, tell us a little bit about your business.
Brown Dog started about 6 years ago, and we started making ice cream and some cakes and stuff, and it's just kind of grown and taken on a mind of its own ever since then. And now we had two restaurants, one in Northville, one in Farmington, but the Farmington one did not make it through COVID. But we also did open a 12,000 square foot production facility in Oak Park last April. So right when all the shutdowns were taking place, we were trying to open our doors.
Oh my gosh, what a challenge.
Yeah, it's been crazy.
So with that, when you say we started making ice creams and cakes, these are not ice creams and cakes that you get, at Kroger. I mean, it's like a work of art. How do you come up with some of your flavors?
The flavors are the easy part. It's the names that are really challenging to figure out. We just like to do things a little differently. And so, it's some of it's classic food pairings and stuff like that. And we've got a team we call it a creative team, and we sit down and we throw around some ideas and see what we can come up with. But our whole focus is not to do things that you can find anywhere else, because then why do you come to us versus anybody else?
So with that too, what are some of the names? You guys are pretty creative though, I have to tell you.
One of the names we have right now, a flavor that's been around since the beginning, is called Who Needs a Therapist? It's a dark chocolate ice cream with a peanut butter ribbon. It's just to die for.
Well, right now, that's pretty much everyone.
Yeah. We have another one that actually just went out of production a little bit ago, called I Like It a Latte, which is a vanilla bean coffee ice cream. And a new one, we just did a Butterfinger ice cream, and we're calling it Crispity Crunchity, because that's what you see at the bottom of the Butterfinger label there.
So with that, you open up a production facility as the world is shutting down. What's it been like over the past year for you guys?
It's been a whirlwind of, are we open, are we closed? What about our vendors? Our restaurant is, obviously we have customers coming in, and we've had to deal with, shutdowns and openings and all of that. But then from the other perspective, our production facility is mainly focused on wholesale. So grocery stores and coffee shops and things like that. And it's been a real challenge to, not only just figure out production, but get into new accounts, because grocery stores are all so busy that, they're short-staffed and they're overworked, and they don't have time to consider new products. Distributors are hesitant to bring on new products right at the moment because they don't exactly know what the future is going to look like. So it's really been a learning curve of a year in all aspects for us.
Paul Gabriel with us here on the Megacast. He's the co-founder and CEO for Brown Dog Creamery. And what have you learned through this past year that you think has been a positive that you'll take away post-pandemic?
Just always be ready to pivot and adapt. I mean, you never know what is going to happen the next day. You think your business is going the way it's going, and it's always been going that way, and then the next day you get shut down from a global pandemic. So just always be willing to adapt and overcome. So, and with that, how important has it been for you to try to market your product throughout this time and at least keep it in the forefront? I think it's been crucial. When the first shutdown happened, my partner and our director of operations, like overnight, they spent 24 hours and they rebuilt our entire website from the ground up, all to focus on, curbside pickup and delivery and all that kind of stuff. And it worked really well. I think it was a big key to our success is that online ordering and the ability to change our model in a matter of 24 hours. And then from there, it's just staying top of mind. There's so much going on in the world, and it's how do you, keep your brand in front of people. And for quite a bit, and still, ice cream is fun, food is fun, drinks are fun. And so we were able to hopefully bring some, smiles and brightness to people's lives in some dark times. But it was very important to stay in front of top of mind, basically. So where can people find your product? So, of course, we have a restaurant in Northville, which we call it a barler. So it's Brown Dog Barler and Restaurant. So it's an ice cream store plus a bar. We got a full line of ice cream there. We have craft cocktails. We call our menu upscale bar food. So you can enjoy any of the products there. We also have, like I said, other coffee shops and bakeries and stuff like that. We're in a few grocery stores. The easiest thing to do is if you go to our website, browndogcreamery.com, we have an ice cream locator that you can type in your address and see what's near you. And then, of course, if you want to see us in some stores that we're not in right now, then, let those stores know that you'd like them to carry our product. So I see that you have the Cadbury cream egg. Correct, yeah. That one is cute. So I don't know if you guys have seen it, but Cadbury is doing this nationwide search for the new Cadbury bunny for the commercial. Oh. And there's a small horse in an Oganac that is in the front running for that. So I think you guys should get Blondie the horse with your dog, your brown dog, and you guys right there. There you go. And then you have a match made in heaven. At least vote for the horse. Yeah. With that, though, so tell us the background behind the name. So, people always say, why did you call it Brown Dog? And I said, because I have a brown dog. It's not complicated. I've been in the ice cream business for a long time, and my first store was a soft serve store, a seasonal soft serve store. And we named it after my first Boston Terrier. His name was Stuart. And so the store was called Stewart's of Novi. And so that started. And then the legend has it that shortly after that, Flash came into the picture. He's the brown dog, and got jealous that he didn't have a store named after him. So when we decided to open Brown Dog, the name Flash's Ice Cream or Flash's Cream, it just didn't roll off the tongue, and so Brown Dog it was. It's simple as that. Paul Gabriel with us here. He's the co-founder and CEO for the Brown Dog Creamery. What do you hope to accomplish in 2021? People are vaccinated. We start to get back to normal. What's your hope for this next year for your company? To not have any more shutdowns. It's pretty, after COVID hit, my goal in life for year to year is just not to go through it again. So, I'm very optimistic for 2021. I think it's going to be a great year. I love that the vaccines are out there. I can't wait for everybody to get vaccinated, and for us to all just get back to some normalcy. It'd be really nice. So what's it been like for you on the employee front? A real struggle. That's been our number one challenge. That's the reason why our Farmington location did not make it. It was not a sales thing. It was all staffing. We really struggled. We didn't have enough staff to run 2 restaurants, let alone, or 1 restaurant, let alone 2. We're still very short-staffed. And we're a little nervous as things pick up going through the summer. It's our busy season, and we can't get applicants right now. I hear from a lot of business owners.
Wow, that really is amazing. But we are seeing that you can drive up and down any major roadway and you see help wanted signs all over the place. So it's so important to try to find, hopefully maybe when college students start to come home, that can help you guys out as well. I will say, so sales-wise though, because I mean, booze and ice cream in the middle of a pandemic, they really seem to be needed items. Not a luxury, right? But just needed items to help comfort us throughout this time. So with that, are your sales doing okay though?
The restaurant sales for Northville are doing okay. The city of Northville has been absolutely wonderful. They shut down the street and let all the restaurants spill out and do outdoor dining. They have a social district going on in downtown Northville. So Northville has been doing well through everything. Obviously, we did lose 1 restaurant, so that was a little bit of a struggle. And then from the creamery side or the production facility, it's been a little bit of struggle there. Again, just getting new accounts. And having to deal with the accounts that we do have, whether they're open or closed. And so overall, like I said, I'm very optimistic for 2021.
How about the catering side? Pretty much shut down?
Yeah, although we are seeing that people are starting to think about having, maybe small weddings or small backyard get-togethers, family reunions, stuff like that. I think it's going to be a while before we see the big events that we once saw. But I think people are pent up and they're ready to start planning some events again.
What's your favorite ice cream?
I would say right now it's a tie between, as I said before, the Crispity Crunchity, which is a Butterfinger ice cream, not that creative, but just really, really good. The other one we just, it actually hasn't launched everywhere, but we do have it made and ready to go, is called Midnight Cherry Fudge. And it's got these black cherries in it that are just, I didn't really think it would be such a good flavor, but it is so damn good.
I will say though, can you find a way to take the calories out?
Oh, I personally remove every calorie.
That is awesome. Because I'm looking at your website. It's like brookie dough, the Cadbury cream egg, Nutella.
Yeah.
Nutella sales
Pinterest
went through the roof once Pinterest came online, because you can't go on Pinterest and not find Nutella recipes. PB&J. What's the Super Day?
Super Dog, is it?
Oh, is it Super Dog?
Super Dog. So that's our version of Superman.
Do you make any ice cream for your pets?
So we call them Pooch Pops. And so we have an almond milk ice cream that we use for our vegan flavors and stuff. And then what we do is we just make it basically a peanut butter almond milk ice cream, and we put it in little pucks, and they're called Pooch Pops. And so it's a non-dairy. I mean, it does have sugar in it, but it's a special treat.
Oh, I'm going to swing by and get some. Every Saturday, I take my dog, Trixie, to get a puppuccino. And so they know her at Starbucks every Saturday morning. She drives you crazy until she gets her puppuccino. So I'll have to get her on her ice cream fix next. So. Paul Gabriel with us here on the Megacast. He is the co-founder and CEO for the Brown Dog Creamery. Anything else you want to maybe add before we say goodbye to you today?
No, just like I said, we're really excited about 2021 coming out of this pandemic. We hope everybody stays safe and follow all the recommendations that you can, and hopefully we'll have a great year.
Well, fingers crossed. And also, I think your dogs deserve a treat because they were quiet throughout the entire interview.
Yes, they were. They're sleeping away.
We don't even hear them snoring.
No.
Paul, thanks again for your time. We so appreciate it. Again, support local throughout this time. It's so important. We know that, so many of the big box stores and grocery stores are going to survive. They, in fact, have been busier than ever. But please find ways to support some of our local businesses throughout this time. We're going to take a quick break here on the Megacast, and when we come back, we will round out the show talking with the Executive Director for Affirmations. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside the one, the only Mr. Tyler Keith. Just about 20 minutes left in the show, and again, the 2 hours just goes by
every
so
time.
fast.
It does. Every single time. It's been doing that for a full year. I don't know what's going on with these 2 hours.
For
10 a.m. to 12 noon, 5 days a week for the last year, except the first week, which was 3 days. But who's counting? Flies by.
I will say, I remember at one point in time we were talking about, hey, is it time to scale back the show, because we thought we were kind of coming out of the pandemic, and what could we possibly talk about?
No, of course not.
But no, we are still here, still 2 hours long, and one of the reasons we continue the show is to be able to bring you these long-form interviews so that you can really hear for yourself from the people that are all impacted by COVID-19, and that includes pretty much all of us and so many of our nonprofits right now, Tyler. The need is great, but they're also struggling financially because trying to fundraise during the middle of a pandemic is not the easiest thing to do. We are going to bring into the show now Dave Garcia. He's the Executive Director for Affirmations. Thank you so much for being with us.
Good morning.
For those not familiar with your organization, give us a backdrop to your mission.
Sure. Affirmations is Michigan's largest LGBTQ community center. We're located in the heart of Ferndale on 9 Mile. We have been around for more than 30 years, 31 years, and that's pretty unusual in the LGBT rights movement. We own our building, which is also unusual. We paid our mortgage off a number of years ago. And so the community owns the building. It's a beautiful 3-story building, about 17,000 square foot. And we have all types of programming, from youth programs all the way up to one of our largest programs, which is our LGBT seniors. And everything in between, whether that's, we have AA groups and Narcotics Anonymous groups and coming out groups and trans groups. And we have special events all the time. Well, before COVID, people would come in and have art openings. We have a beautiful art gallery. We have a large community space where the governor, for example, has been there twice in the past 2 years to talk to the community before COVID. We do a lot of advocacy and political advocacy for our community as well. So really, we're kind of a one-stop shop. People come for therapy at Affirmations. We have a computer cyber center at Affirmations, a game room at Affirmations for our youth. So there's a lot going on. And then, of course, COVID about this time last year, we had to close our doors. So all of those groups I just mentioned are online right now on Zoom. And we've turned a lot of attention to food insecurity. So every Wednesday and Friday, we have what we call the Let Us Help You food program. And we've been handing out boxes of food out of the back of Affirmations. People can just pull up in their cars, pop their trunk, and then we have volunteers and staff that fill that trunk up with foods or soaps and shampoos or winter clothes, masks, those kind of items that are very necessary right now. To date, we've handed out over 4,500 meals. And we also have been delivering with Instacart meals directly to the front doors of many folks that can't make it to Affirmations, including many of our seniors.
You are so vital to our community. Your organization has 30 years. How has the conversation changed? Because sadly, I feel like sometimes we're having the same conversation.
That's a great question. I mean, obviously there has been significant progress. I just got back from a stint in Los Angeles. I was the executive director of Affirmations. And then I went to LA for just over 5 years to start with the Los Angeles LGBTQ Community Center, which is the largest LGBT organization by far in the world. We started a political wing for that center. And then I came back, it'll be 2 years this May. I came back from Los Angeles, and we are still dealing with just this past Friday, we had so-called Christian protesters out front of Affirmations with their signs of, God hates fags and people, you'll burn in hell and all of it. Here we are giving out food in the back at the same time that we've got these Christian protesters in the front and trying to deal with them. So you're right. Sometimes things seem like they're not getting better, or we're still dealing with the same ignorance and bigotry and homophobia. But the truth is things are getting better. 2 steps forward, 1 step back is still progress. And, we have same-sex marriage now. That was a long battle. Things like don't ask, don't tell have been overturned. But we still see, for example, the rise of hate crimes against our community in the past few years. We still see Black trans women of color being killed in the streets of Detroit and really all across this country. So we have much, much work to do, but we have made progress.
How do you stay hopeful?
The youth help a lot. We have a lot of youth programs, and I see the youth on a regular basis and their ideas and what they're going to do in the world of, climate change and how that affects all of us, especially including the LGBT community. You take an issue like immigration. People might not first assume that is an LGBT issue, but it absolutely is. We have people coming from all over the world that if they get turned back to their home countries can be jailed, imprisoned, or killed. And so immigration is important for our community. And when I hear young people talking about their support of DACA students, for example, or their support of making the world a better place for all of us, that gives me a lot of hope for the future generations. And we continue to see more and more people come out, which is always, as Harvey Milk said, the greatest single thing any of us can do is to come out. LGBT folks are in every family, as we know, and every political party and every race. And so when people come out and they force their families and their loved ones to take a long, hard look at this issue, that's why we've seen so much progress. And the young people, the younger generation is coming out in record numbers.
I will say I've been surprised, but also pleased and happily surprised that so many students now, even in junior high and high school, are coming out and being open at sometimes a younger and younger age. And I feel like it's like you said, Dave, it's about the kids, right? They don't have the stigma that I think is our generations have had to deal with, but now it's about educating their parents and their grandparents. But when it comes from, student to student and youth to youth, they seem to be more accepting today.
I think that's true. That is absolutely true. I would also, though, be careful, and we certainly still see young people who continue to get kicked out of their homes, often for religious reasons. I have said time and time again that the religious exemption is the single greatest threat to our community since HIV/AIDS, and we are seeing the religious exemption and religious exemption laws pop up all over the country, protecting for example, just a couple of years ago, we had a pediatrician right here in Detroit refusing to treat a baby because the baby's parents were lesbians. That person didn't get fired or fined or anything. And we're seeing more and more doctors turn away LGBT people in both primary care and in mental health across the country, refusing to, for example, give hormone therapy to a trans person. And then they hide behind the religious exemption to protect themselves. And I think not only are we seeing more laws pop up, but with a 6-3 conservative majority on the Supreme Court, these religious exemption cases are a great threat to our community. It's why Affirmations will be expanding into primary care, because we have a responsibility to protect our own if they're not receiving culturally competent and scientifically accurate care from their own doctors. And by the way, I want to point out that it might not be that the doctor is simply homophobic, right? It could just be a cultural competence and ignorance thing. For example, PrEP. PrEP is a pill that you can take every day, and it's 99.9% effective against the HIV virus. Many doctors don't even know about PrEP. They weren't taught about PrEP, of course, when they were in medical school. And so it may just be an issue of not knowing the best way to treat our youth, our trans community, our seniors. When you think of seniors, think about the life that they lived. You know, speaking of our youth today, let's go the opposite direction. Many of our seniors lost their jobs. They lost their families. They did not have children for the most part as a safety net. They might have been with their partner for 30, 40 years, and then that partner dies. They didn't have marriage. They don't have the Social Security safety net that the straight community had. Then they go to assisted living, and many of those assisted living facilities are religious-based. And so out of fear of mistreatment, they go back into the closet, which is a horrible thing. And we're seeing that today. So, and again, even if those religious-based institutions, those facilities aren't homophobic, many simply lack cultural competency to treat the senior community. So we have a responsibility at Affirmations to train doctors and to train therapists and to train health providers. But we also have, I think, a responsibility to treat our own and to protect our own. And so that's why we're going to be expanding vastly into primary care.
When do you anticipate that's going to be happening?
We're close. We're going to start construction very soon. We've already have the designs. One entire floor of our building will be primary care and mental health. We already have a mental health program, but we work with local universities. Their graduate level students get practicum hours to see our clientele on a sliding scale. And then those cases are reviewed by a licensed therapist that we have on staff. I'd like for us to have licensed therapists that can take any insurance from anybody every day of the week at Affirmations, and then of course primary care. So the redesign of one of our entire floors to make sure that that can happen, we've already done the design, the coding, all of that stuff is already passed through City of Ferndale, and so we're ready to send out bids and start construction very soon.
Dave Garcia with us here on the Megacast. He is the executive director for Affirmations. And Dave, the Vatican recently came out and said the Catholic Church cannot bless same-sex marriages. How much of a setback is that for people within your community?
Well, it is a setback, but first let me say, you know, I was raised in a Mexican-American family. I'm very close with all of my family and cousins and aunts and uncles in a very Catholic family. I was an altar boy my entire youth. I coached basketball and baseball for St. Mary's Catholic sports programs. I worked for Catholic Social Services for a stint. It's deeply personal as well. And I am the only member of my very large Mexican-American family who is no longer Catholic. In fact, I am an atheist. And a lot of that too was just the constant ignorance and homophobia that continues to come from the Catholic Church. When the amendment to the Michigan Constitution to ban same-sex marriage happened back in 2004, it was the Catholic Church who gave the most money to support that amendment. And so we have always been battling with the church. It is a setback, but there are other denominations who do not have the homophobia of the Catholic Church. You know, there's the Episcopal Church, there's the United Church of Christ, there's the Unitarians. The list goes on of Christian denominations that don't have the asinine policy of the Roman Catholic Church. And so I think, you know, part of the reason why you see participation continue to dwindle in the Catholic Church is because of these archaic beliefs that the church continues to espouse. And frankly, you know, I'm not going to be judged by the oldest boys club in the world about who I can love or not love. And, you know, maybe someday when a female pope is apologizing to our community, I'll listen.
Dave Garcia with us here on the Megacast. He is the executive director for Affirmations. And when you talked about taking 2 steps forward, 1 step back, we now have a proposed state law that would prevent transgender high school athletes from playing. Where does this come from?
Older generation. I mean, this has never been a problem. Trans students have been playing sports for a long time now without incident. And look, everyone has a right to participate in sports. That's the bottom line. And some trans athletes are better than others. That's always been the case. And this is just blatant discrimination targeting the trans community. It's the next evolution of the bathroom scare, right? That's what it is. And they get political, mileage out of scaring people that the trans folks are gonna attack you in the bathrooms. That has never happened. It's ridiculous. And now that has kind of faded away, and now they've latched on to this new issue of scaring everybody about trans athletes. And of course, it's only the male to female athletes that they're scaring everybody with. And it's sad. I don't think it'll pass. Even if it did, the governor will never sign it into law in our state. And so they're just trying to make political hay and raise money and scare people like they always do.
So with that, when you see proposed bills like this be made public, does it kind of re-energize you to continue this conversation and try to educate the public?
Sure, it does. And when I got back from Los Angeles, I serve on an organization's board known as Centerlink, and it's the National LGBTQ Community Centers Network. There are over 250 centers throughout the country. And I'm on their board, and they do great work, especially in areas like this, public advocacy, where they can educate all of those LGBT community centers who are often very small. Many are just volunteer-based, who don't have the time and the resources to be able to disseminate information like this to their constituencies. And so Centerlink does the work for them. And when I got back from LA, we created the Michigan Community Centers Network. There are 10 community centers throughout the state of Michigan. In fact, we're meeting later today. We meet every other month to discuss issues just like this and how we're going to respond and how we're going to work together to have more of an impact than any one center could have.
By coming together, there's strength in numbers. Is with this. So as hopefully we are starting to have more hope with the vaccination, has the need been greater for you and your center throughout this time?
Not just our center, all centers. And I get a unique perspective serving on the board of Centerlink. All centers across the country have increased need, but more and more difficulty in fundraising. Typically, your fundraising buckets for a nonprofit are going to be individual giving, grants, and special events. Well, Affirmations is no exception. One of our largest fundraising event is our black tie that we do every year. And we lost that last year. That's over $100,000 in revenue. And so another one of our major events is a wine party that we throw at the center. We lost that. That's $50,000 in revenue. And every center is facing similar challenges. Now we've switched focus. We did a telethon. It was a 9-hour-long, professionally produced telethon for Affirmations to try to make up for some of those monies. And we still did a 2-hour virtual black tie type event to try to replace some of those revenues, but it didn't come close to the hit that we took. Now we are able to apply for things like the PPP from the federal government, and many community centers across the country did receive monies through the stimulus. And that has been a bit of a lifesaver for many of us as well. So while we are losing significant revenue, for example, individual giving, many people aren't giving as much because they're afraid they're going to lose their jobs, or maybe they did lose their jobs. But other people have given more in this time of need. And so for us, individual giving was up, grants were up, but special events took a big hit.
Dave Garcia with us here on the Megacast. If someone is listening, maybe a parent, they want to start the conversation or they want more information, how can they find that?
I would say go directly to Affirmations website at goaffirmations.org and talk to our program director. Would make a lot of sense, or even reach out to me and I'll put you in touch with the right person. And if we can't help you, we have a vast network of referrals to help. And so we can also get them involved in one of our groups. You know, one interesting silver lining is with everything going on to Zoom is we've had many more young people from rural areas, seniors from rural areas, trans folks from all over the country, and really even out of the country that are starting to come to our groups because they're on Zoom now, and teletherapy has taken off. So we're never going to go back to the way it was. There will be a new normal, but we can get them in touch with any group, whether it's a coming out group, a trans group, a youth group, a senior group, that can help them, and they can be supported by folks just like them.
And it starts sometimes with a conversation and reaching out and starting that conversation. Dave, we so appreciate your time and everything you're doing for the community.
Absolutely. Thank you for having me. I really appreciate it.
Well, good luck to you, and let's hope 2021 is much brighter than 2020.
I sure hope so.
Dave Garcia, he's the executive director for Affirmations located in Ferndale. Just about 30 seconds here left in the show. Tyler, again, we want to remind people, of course, the big vaccination, mass vaccination effort that's going to be happening at Ford Field. Mm-hmm. Take time to register. Even if you're not quite qualified just yet, get your name in the queue because it will be opening up to more people in the coming days.
Yes, and all that information, again, civiccentertv.com/coronavirus. You'll have to scroll down just a little bit, but in one of our more recent stories announcing the opening of registration, we have all those details for you.
That's going to wrap it up for the Thursday edition. Thank you. We'll be back here tomorrow at 10.